Hello, a very good morning to everyone. Can you guys hear me? If you can, perhaps you can just type down something in the chat panel for me to know. Just number one would do. Oh, okay, yep, great. So a very good morning to everyone. We will be starting on time, and let me just go through some standard housekeeping rules before we officially start the session today. So I will be reading this out because obviously the Naluri team prepared this. To make sure that this session is smooth, you are advised to use the supported browser like Google Chrome, Firefox, and so on, and ensure that you have stable internet connection. You hopefully you have already tested out your speaker. You plan to turn on your mic to ask questions later, but always you can just type down your questions in the chat panel. If you are experiencing any issue, be sure to send a private message to Naluri events, because when Jess and myself are, presenting and discussing issues, we'll probably not directly attend to you. Someone will highlight these questions to us. If there are some things that you would like to talk to us directly, you can just add us when you have a question you want to address to us. You can just mention us in your question. If you choose to ask your questions privately, there is a private questioning function in the chat panel as well. And whatever we present today will be made available in PDF at the end of the session. So a bit about myself. You can just call me Shawn. I am currently a senior lecturer at Monash University. And I'm also a sessional consultant at Hospital Selayang. And I also run my own private practice called Consultancy Psychological Services. I have been working as an independent contractor for Naluri for quite some time now. And this time they engaged me to talk a bit about sleep. And my area of specialty is in pain management. So this pain is the type of pain that will never go away. And as you can see, when someone has pain, most definitely they will have sleep issues. And that's how I got some, specialized training in sleep management as well. And I will pass on the floor to my colleague, Jess, for her to do some self-introduction. And then she will follow with some of the information that they want to share with us.
Can share.
Take it
Thanks so
away,
much,
Jess.
Shawn. Hi, everyone. Very good morning to all of you. It's so nice to see. We have about 240 people on this call today. So, welcome and thank you all for joining us today. And hopefully, today will be a very informative session for all of you. So, just a bit of introduction about myself. Are you guys able to hear my voice? Yes. Okay. Awesome. Okay, perfect. All right, wonderful. Yes, so just a little bit of introduction about myself before I kind of jump into some information about sleep. So I am the founder of my own private practice. Which is also called Garden of Healing Counseling. I'm also a mental health coach with Naluri, as well as the Careline counselor, part of the 24/7 hotline number as well. So I am a registered and licensed therapist. My master's was in counseling, but you also notice that I have a background in science and physiotherapy. So there was a bit of a career pivot, career change. And the area of specialization that I predominantly work in is with trauma based clients, relationship and marriage counseling as well. So, a lot of the work that I've done with sleep was also part of the physiotherapy career that I had previously. And there was a point of time in my life as a counselor as well where I worked for a company where we had to do counseling for clients in the night shift, right? So that means I, as a counselor, was also doing the night shift timings with the clients. And so that's where the area of sleep and how to manage sleep better really came from. All right. So let's just kind of get started and jump into today's session and learn a little bit about sleep, the science behind sleep, and the importance of sleep and how that can really, affect us, right? So we're going to look at six different areas today. The first one being memory, right? So sleep plays such a critical role with our memory, especially our declarative memory or procedural memory. Essentially, what that means is for us to retain facts and information, as well as skills and habits as well. Right, so with adequate amount of sleep, the brain is able to process this information and store information. So this is why you notice when you don't have enough sleep, at times it's quite hard to recall or retain certain information. I can see in the chat some people are having trouble hearing me. Shawn, are you able to hear me? You're able to hear me, right? Okay, all right. I think it's a issue that side. All right, awesome. The next one is attention and focus. So you'll notice that when you have poor sleep, when you're not getting enough rest, what happens is that you experience something called brain fog, right? It leads to poor decision making, it reduces your ability to even multitask at time, and you'll notice that your reaction is a lot slower as well. Right, so this is something that we have to kind of keep in mind, especially if you are in a leadership role or you asked to lead a team, or you're managing different stakeholders as well, right? Now, the third area is decision making and problem solving. So, when you're sleep deprived, more than likely it's going to affect your ability to make clear decisions. It's also going to definitely affect your ability to make clear judgment, and at times, your ability to make rational decisions can also be affected as well. Right, so it's really important that you prioritize your sleep, especially when it comes to making big decisions or solving problems depending on the capacity that you're at work. Right, now emotional processing is also a very big part, and later Shawn is going to talk a little bit about REM sleep. But essentially, when you have adequate amount of sleep, it helps you actually process and regulate your emotions a lot better. Now you'll notice that when you don't have enough sleep, you become more irritable. At times, you get quickly triggered. You might get frustrated. You might even have anger outbursts as well, right? And all of this can also be because of stress, right? So all of us goes through different types of stress in our life, and poor sleep affects our ability to handle stress, right? The resiliency of stress. Now, we talk about chronic sleep deprivation. Over time, what happens is that it affects the part of your brain called the amygdala. The amygdala is basically also known as the emotional center of the brain. Now, if you're not getting enough rest or enough sleep, what happens is that you are more prone to having negative emotions. So you'll likely feel a lot of frustration, anger, anxiety, and sometimes even depression as well. So it makes it hard for you to cope with the challenges or stresses that you're facing and experiences at life, right? Now, the last one is mood regulation, right? So, with a sufficient amount of sleep, what happens is that you have a balance of neurotransmitters, also known as serotonin or dopamine, which is the feel good hormone, right? They help to regulate your emotions. So, generally, we can see that there are so many areas that can affect us if we do not take better care of our sleep or have enough or adequate amounts of sleep. All right. So I'm going to do a quick poll with you guys and see what is the general consensus out here. We have about 300 plus people on the call. So feel free to click the options that resonate with you. So the first question, right? On average, how many hours of sleep do you get on a weeknight? Right. So I know some of us we work from home, some of us we work in the office. Of course, if you're working from home, you probably might have more sleep because you wouldn't have to wake up early or go to bed early for your commute, right? But generally, let's have a look. So we have about about 55% of you that have about 6 to 7 hours of sleep on average, which is great. 2% that have more than 8 hours, which is also really good. And we do have quite a small amount of people that have less than 4 hours of sleep, right? So on average, you want to be having about 7 to 8 hours, right? So that's pretty good. Next question: how often do you feel well rested when you wake up on a work day? All right, we're still getting answers coming through. Okay, sometimes I think the highest percent here, Shawn, that we're seeing is about 63%, right? Sometimes. So I think I take that the crowd here are not feeling well rested after their sleep at the end of the day, right? Okay, next question. What time do you usually go to bed on the weeknights? Okay, a big majority here we can see is after 11 p.m., right? About 62% of you go to bed pretty late at night, right? And I can see that no one goes to bed before 9 p.m., right? So that's, yeah, oh God. Okay, so I think roughly about 10 to 11 and after 10, 11 p.m., right? So we don't really get enough of sleep. Now, how many times per week do you have trouble falling asleep or staying asleep? How many times per week, right? On average. All right, so I think majority would say about 1 to 2 times per week. And that can look differently for everyone depending on the different factors as well. But I think on average, people do have trouble sleeping maybe between 1 to 3 times per week. Right, that's what I can see. We do have quite a percentage of people that don't have trouble actually falling asleep. So I guess once you hit the pillow, you're out cold, and you have that quality amount of sleep. All right. Next question. Which of the following habits do you regularly do before bedtime? Okay. So as expected, I think the highest percent that we see here is the usage of electrical devices, right? Your phones, your iPads, your laptops. And we have quite a small percentage of people who actually engage in reading or relaxing activities. So not many of you are actually, engaging in these kind of activities before going to bed. Maybe about 4% of you are exercising right before bed, and I think what happens is that your heart rate definitely is increased after exercising, so you may have trouble actually falling asleep, right? So, but I think the majority here is the usage of electronic devices, right? Which is something that we all are familiar with, right? All right, and I think this is probably the last polling question that we have, if I'm not mistaken. So, what do you think is your biggest barrier to getting quality sleep? And there's so many different factors that we can see here, right? Okay, so I think what we're seeing here is poor sleeping habits. So it's more of a habit that we've acquired and kind of hard to kind of break the habit, right? Especially with irregular sleep schedules or even the usage of screen time. I think the second one we're looking at is work stress or deadlines, right? So I think some of us might be having a lot of expectations that we have to fulfill, and therefore not having enough hours in the day to complete it as well. Family and personal responsibilities, I think, falls at number three as well. Right, there's just so many things to do and prepare for, especially if you're having like families, right? Alrighty, I'll pass it on to Shawn to take it away from this. But thanks, guys, for answering the polls as well.
Okay, thank you very much, Jess. So I will follow up with the discussion based on the responses that you guys have provided to us. Basically, I want to make this a bit more meaningful and more tailored to our audience here. So I want to add a few points to whatever Jess has mentioned just now about, memory consolidation, attention, decision making, and so on. We know that sleep is essential for memory consolidation, which means that everything that you are learning throughout the day or you're exposed throughout the day, if you don't allow yourself to sleep sufficiently, these new learning experiences don't actually get integrated into your memory and your mind. So I'm not sure whether you guys have, personal experience of something like this. When you were younger, you would burn midnight oil to study, especially the day before your exam, and you would study through the night, and then you just keep rehearsing and repeating the things in your mind, and you go into the exam hall, you just vomit everything out, and then right after that you allow yourself to relax, and then you go sleep. The next day you wake up, you basically forgot everything that you have learned, right? So after you deprive yourself of sleep, you just keep repeating the information, and then after the exam you just totally forgot all the information, but you pass the exam. That is actually the worst way to learn, mainly because when your brain is sleep deprived, the information that you have in your mind, in your brain, is merely just stored in something we call the short term memory. And if you don't allow yourself enough time to sleep, information in the short term memory will not get integrated into the long term memory. So, although you will be able to answer some questions in the short term, you don't actually learn it in the longer run. So, a better way to learn is really to um, distribute your learning in smaller chunks, right? Learn a bit, allow yourself to sleep, learn a bit, allow yourself to sleep. Take small naps while learning. So sleep is important even for learning, even for kids, even for adults. And a lot of us really just don't think about this. We just work throughout the day. And then when it's at night, when it's really I see Putri mentioning that it's her, right? When it's really time for us to sleep, we can't stay up anymore, then we go to bed. And sleep is something that we deprioritize in our life, right? It's something that we have to do. But if we understand the science of sleep well enough, we will be able to plan our sleep in a way that would optimize our life. Now, another thing that I want to mention is about decision making and attention. We have a lot of studies to indicate that someone who is sleep deprived, their driving performance is actually almost as bad, if not worse, than a drunk driver. Which means that if we don't allow people to drive after drinking, we should not allow people to drive after being sleep deprived. But this is not something that we pay attention to, and it's definitely not in the law. We have a lot of data to suggest that internationally, not only in Malaysia, a lot of deaths can be accounted for, can be attributed to the lack of sleep. So, at Monash, my university, we are paying a lot of attention on sleep, and we have a lot of research projects regarding sleep. It's clearer and clearer to us that sleep is now a public health issue. It's no longer something that, I will think about it when I have the time to. All of us have to strive to have a better sleep schedule. So another thing that Jess mentioned just now is about sleep deprivation. Um, so I will talk a bit about the quality of your sleep, how you feel about sleep when you wake up in a bit, and it has something to do with this sleep cycle. So there are, generally speaking, two types of sleep deprivation. One is something we call total sleep deprivation. It's where you really have no sleep for more than 24 hours. One day we have 24 hours, right? So if you go longer than one full day of not sleeping, that's called total sleep deprivation. And this is something that you should never allow yourself to do, no matter what. A few consecutive days of complete or total sleep deprivation, you may die. Sometimes we see, on the news, some kids play online games, or they have been hanging out a few days straight when they are gaming. Sometimes they may just die in front of their computer. That's probably because of a few consecutive days of total sleep deprivation. And only more than one day of total sleep deprivation, you may start to experience very severe psychiatric symptoms like, hallucination, delusion, loss of memory, very severe stuff. So never allow yourself to not go sleep for more than 24 hours. Now, if you have slept within the past 24 hours, but not enough, let's say you need 8 hours of sleep, but you only slept for 4 hours, then it's called partial sleep deprivation. And this is what we would call the invisible killer, right? Because most of us would think, I sleep for 4 hours, 5 hours. I think the next day when I wake up, I still can function. I think I can I can get by with just having 4 or 5 hours of sleep. But when you deprive your sleep partially, the negative impact and the health consequences will actually come back to bite you much later. You are still accumulating negative health consequences, just that you're not aware of it. So, as much as possible, we should never allow ourselves to sleep less. How long should we sleep? I'll talk about that. Now, I will start to address some questions and some points that we gathered in the poll just now. I saw just now someone asking questions about feeling sleepy. That's one Akmal. Okay, why do I feel more tired if I sleep 5 hours after 12 compared to 5 hours before 12? So if you look at the slide I am showing here, this is what we would call a sleep architecture. What it means is that for the average person, if you sleep and we use something to measure your brain activity, this is what it would look like for the average healthy person. So this is a typical 8-hour sleep session. You'll notice that in the first 1 hour, your sleep onset is basically the moment when you fall asleep, right? So after you fall asleep, from being in the awake state, you will go to stage 1 sleep, stage 2 sleep, stage 3 sleep, and then you will spend some time in stage 3 and 4 sleep. Enough, then eventually your RAM, your eyeballs will start to dart back and forth. Your brain will start to be extremely active for a brief period of time. And this activity is very similar to someone having a seizure. So imagine when you are falling asleep, you become deeper and deeper and deeper. After some point, your brain suddenly becomes very active. And that's one cycle of sleep. After that, you would go into the second cycle that is on the second to third hour onwards. Each cycle of sleep is around 90 minutes, sometimes a bit more, sometimes a bit less, but on average, you can conceptualize as 90 minutes equals one cycle of sleep. In an 8-hour sleep session, we would have 1, 2, 3, 4, 4 to 5, if you can sleep really well, right? 4 to 5 sleep cycles. Most of us get about 3 to 4 per night. Now, then you will notice that in the second round, when you go back to sleep, the shape of this distribution, by the way, can you see my mouse? I presume you can't, right? My cursor? No, okay. Then you just have to pay attention to the second part. So you'll notice that the shape gets a bit different now. You will still fall asleep, you will still be unconscious, but then it won't go as deep as the first round. Because reasonable, then this is logical. Because you have been awake for so long, the first round of sleep must be a bit deeper. And then the second round of sleep, because you already had one round, the second round will not be as deep. So sometimes when you look at your whatever Garmin, or I saw someone mentioning Garmin, right? Your sleep data, it actually takes a scientist to understand the data. And in fact, a lot of scientists don't actually understand the data. So the data that you see on your devices, you don't have to be too worried about it, because there are other ways for lay people to evaluate your sleep quality, which I'll talk about later on, right? So in the second round, you'll go back to sleep, but this time not as deep. And the third round, you see even less deep. And after the second round, you'll notice that when you complete your REM sleep, when you complete the brain very active in your face, you will actually wake up briefly. But this brief awakening moment, most of us are not aware of it. What do I mean by that? So you may wake up a bit, adjust your body posture, pull your blanket from your husband and wife, and then go back to sleep and not even realize that you did that, right? But other people, if they see you, they will know that you actually, sat up a bit, you actually moved your body a bit. But for the person who is sleeping, they may not be aware of it. Some do, some don't, but that's not important, because that brief awakening doesn't affect your sleep quality. It doesn't really matter. And then you would go back to sleep. And then you would see the person going into REM sleep again, and then have the brief awakening moment. And each sleep cycle, you will become shallower and shallower, because you are more rested over time. Now, so let me answer one of the questions that we saw just now in the poll. How many of you feel well rested when you wake up? This has something to do with the timing in which you wake up. For example, here in this particular slide, right, you will see yellow, the more orange color, right, zone is the natural awakening moment at night. The blue color zone is when you are in your REM sleep, and we also believe that this is the time when you are dreaming. So you are dreaming when you are in your REM sleep. If you wake up during the natural waking moment, you will feel very refreshed because your brain memang dah complete one cycle. You have indeed completed one cycle. So if you wake up from there, you will feel very easy, very refreshed. However, if you try to force yourself to wake up when you are in the deep stage of sleep, for example, when you go to stage 3 and 4 sleep, you will find it very difficult for you to wake up. Because during stage 3 and 4 of sleep, your body is literally inhibited. So you will feel that your body is very heavy. It's very difficult for you to move. If you have carried someone who is in a very deep state of sleep before, you'll notice that carrying them is a bit like carrying someone who's drunk. They will not help you at all, right? You have to literally bear their whole body weight. Whereas someone who is lightly asleep, you can actually just hold them a bit and carry them, and their body will naturally adjust to you. So the feeling you get when you wake up has a lot to do with the time in which you wake up. So for those of you who feel that you have to wake up struggling every single morning, every morning when you wake up, you have to fight with yourself, my guess is there is a good chance that you are awakened by your alarm clock. You're not waking up naturally. So most of us have to rely on the alarm clock to wake up. And most of the time, the alarm clock, yep, I see some responses saying yes already. And most of the time, the alarm clock is actually interfering with our sleep cycle. If we can train exactly, I snooze also. But then the problem with snoozing is that when you snooze, you go back to sleep, your brain is repeating the same cycle. So the first snooze is actually going to make your second snooze even harder to wake up. When you go back to sleep, you're starting the cycle again. So the best way to wake up comfortably and feeling refreshed is to train ourselves to find the right timing to go to sleep, right? So you calculate the time, 90 minutes per cycle, and you want to go for 4 to 5 cycles per day, and let your brain naturally wake up the next day. Of course, for working people like us, it's very difficult for us to get the full sleep. You should actually avoid snooze. In fact, if you you are awakened by the alarm clock, just waking up is easier than going back to sleep after your snooze. The snooze is actually making you're restarting the cycle again, and it would cause a lot of problem awakening. However, the good thing here is the problem is only limited to the moment when you wake up. Once you force yourself to wake up, you go brush your teeth, you go take a shower, but once you freshen up, it doesn't really affect too much. So really the feeling is more about fighting the natural urge, right? Fighting the natural urge to go back to sleep. But it's not really harmful as long as you get enough hours of sleep. So that's the first thing that I want to address now. So the second thing, right? How long do we have to sleep? How much time, right, should we allocate for sleep? This is a particular slide to show us the change in our waking and sleeping time distribution across our age. So from age 0, meaning infant baby, up till 85 years old. And if you are older than 85 years old, every day is basically a blessing. So the data actually doesn't show that much. But I'll explain what it means here. So you'll notice that most of the time, babies spend their day sleeping. They would only wake up when they need food. If not, they would just sleep through the day. And we believe it's because the babies, after being delivered from their mother, right, being born from their mother, still need a lot of time to develop their brain. Hence, sleeping is associated with brain development. And the brains of babies develop very quickly, and they need to sleep to allow for that brain development. But as we grow, you'll notice that our waking time will naturally increase. You don't have to force a baby to wake up. They will naturally wake up, right? And when you reach a certain age, especially older age, you can't even sleep that much, even if you wanted to. And for most of us, right, our productive years is between the age of 21 to, let's say, 60. You'll notice that this age, right, around 21, here, somewhere around here, to 60, our sleep pattern is pretty stable. There is no, significant reduction or significant increase, which is why a lot of the sleep recommendation is actually meant for our age group, not for someone older, not for someone younger. For younger individuals, we should actually allow them to sleep as much as possible, which is also why our previous education system didn't actually account for that, right? We should actually allow kids more time to sleep. In the Western countries, they have now been informed by scientific data and now trying to adjust the school time of teenagers, because they notice that teenagers naturally have a later sleep onset, which means that they really feel sleepy much later in the night rather than earlier. So even when you had very good sleep habit when you were younger, let's say you go to bed at 9 p.m., when you reach teenage, especially around 16 to 18 or somewhere around there, right? You will notice that 9 p.m. you really just don't feel sleepy, but you will start to feel sleepy after 11 to 12, right? Gadget is another complication. That's another thing that people criticize for. But there's also compelling evidence that when you're a teenager, your sleep onset tends to be delayed a bit for that period of time, right? Now, so another thing is for elderly. I'm not sure how many of us here are older than 60, right? Overall, our previous data suggests that when you are older, you don't need as much sleep. And that's how we clinicians advise our patients. We will tell our patients that if you're old, if you're sleeping less, you don't have to be too worried about it because it's natural. The newer evidence is suggesting that this is not the case. Even older adults, older elderly, right? Even if you don't feel sleepy and you feel like you have energy to sustain throughout the day with sleeping less, you should still sleep more. You should still target about 6 to 8 hours of sleep, even if you feel like you don't need to. Because there has been some data suggesting that reduced sleep in elderly is also associated with earlier death. So even if you don't feel sleepy, you should still sleep more as an adult. Okay. I'm seeing a lot of questions. We will address it later on, right? I will continue to share some of the important information we have planned for here. Now, we also asked questions about difficulty sleeping. Generally speaking, there are only 3 types of sleep problems. You may feel that your sleep problem is very complicated, but when we manage it clinically, we generally need to know 3 things only. Number 1, do you have difficulty falling asleep? This is called the initiation of sleep. Number 2, do you wake up very easily after you have fallen asleep? And number 3, once you wake up from sleep, can you go back to sleep? Now, with these 3 characteristics, you can have a few combinations. The most common type of sleep problem is called initial insomnia. This is when a person has difficulty falling asleep. They may spend more than an hour or 2 to make themselves fall asleep, but after they fall asleep, they can sleep through the night very well, no problem, until the next day, right? This is the most common type of sleep problem. And if you have this, congratulations, it's very easy to treat. You just have to learn some techniques, which I'll share in a bit, right? There are also some people who can fall asleep quite easily, but then they also wake up very easily. They hear a bit of noise, they wake up. They feel that the temperature is warm a bit, they wake up. Or they just, feel a bit uncomfortable, they wake up. However, they can go back to sleep quite easily. And this can happen to mothers who have just delivered babies. Even if a person is a very deep sleeper, but after delivering a baby, the body will naturally increase this ability to wake up just to check that the baby is okay, and then you can go back to sleep. Same thing, right? Like adults, older adults, sometimes you have to wake up in the middle of the night to go to the toilet, especially men, okay, middle-aged men like myself. But after we go to the toilet, when I go back to my bed, I can close my eyes and fall back to sleep quite easily. Because when you are asleep, during the night sleep session, even when you have to wake up to go to the toilet or to attend to some things, your brain is not fully awakened. It is still in a half asleep state that you can resume sleep quite easily. So the second type of problem on its own, wake up very easily, is not a main problem, right? It's when you wake up, but then you can't go back to sleep. That's a bigger problem. So you guys can type down in the chat panel to tell me what type of problem you have. If you only have 1, you can just type 1. If you have 1, 2, you can type 1, 2. You have 1, 2, 3, you type 1, 2, 3. There's 2, 3, 1, 3. There are a few combinations, right? Some people only have 1 type, some people have a combination. And the interesting thing is, each type of sleep problem is generally associated with different problems. Of course, it's not a direct causal effect. It's not to say that if you have 1 to 2, you definitely have this problem. But we have found predictors and contributing factors that can explain some of these issues. Now, for those of you who have problem 1, Okay, you only have the first type. You only have difficulty following a sleep. My guess is you are thinking a lot during nighttime, right? You use your bedtime to think about what you have to do the next day. You think about your ex-boyfriend, girlfriend. You think about work. You are ruminating in your brain, right? You are thinking about a lot of stuff. The reason why I know this is because falling asleep requires you to empty your brain. As long as you empty your brain will naturally enter the sleep process. However, if you are engaging your brain to think, you are giving your brain signals to keep it awake. We have to understand that falling asleep is a natural process. By right, no one should have difficulty falling asleep if you are sleepy enough. Because when you are awake, your brain will be accumulating some form of neurotoxins, right? Some form of chemical in the brain that will force you to close your eyes and fall asleep if it is of a certain level. So not being able to fall asleep means that you are unconsciously doing something to go against this natural sleep drive. And that's usually thinking. When you engage your brain to sleep, to think, you are not allowing yourself to sleep. And I see Arman mentioning counting sheep actually works, right? Yes, it works if you are not doing it as an audit. Some people, especially accountants, when they work with numbers, they automatically think about, I have to do this right. After one must be two, after two must be three. If you do the reverse one, right, you're doing it as an audit, you're engaging your brain too much. So you want to do it in a way that is very automated, that gets you boring. After some time, you just don't bother about it and then you fall asleep. So what about sleep hypnosis audio? So I happen to be trained in hypnosis because I specialize in chronic pain management. Hypnosis is one of the things that we engage to help patients with pain management. And generally speaking, hypnosis is a good way to help yourself quiet down your brain state. However, as a clinician, my advice is always to use it in the initial phase, but you want to train yourself to be able to fall asleep without any aids. Because sleeping should be a natural reaction that all of us can experience. As long as you are awake long enough, you should be able to fall asleep quite easily. If you train yourself to rely on some other things to sleep, that includes hypnosis recording or melatonin or some other stuff, you are basically not allowing your brain to do its job. So if you have very bad insomnia, in the initial phase, use some form of techniques like hypnosis to help yourself regain the ability to sleep. That's fine. But in the longer run, you have to ditch it, right? You have to let go of it and learn to sleep on your own. Okay, so if you have the second type of sleep problem, right, you wake up very easily, there are a few possibilities. You can have, pretty sensitive sensory information, sensory ability to sense. Because when you are asleep, technically speaking, you don't really hear stuff, right? Technically speaking, you're not paying attention to your environment. But there are some people who can just respond or, wake up when they hear something. And for some people, this is just genetic. This is just who you are. It doesn't affect your sleep whatsoever. There are people who say, I'm a light sleeper. I've always been a light sleeper since young. And we found no evidence that light sleeper has poorer sleep. It's just that your sensory system is still quite active even when you're unconscious, even when you're asleep. We don't see any negative health consequences in the longer run. Same thing with mothers who become a bit more, wakeful or alert after delivering a baby. Most of them can go back to sleep, and that's fine. But of course, if you are the mother of a newborn baby, there are some other issues like feeding, breastfeeding, and also pumping milk. Those other stuff can influence your sleep, but that awakening itself is not usually a problem. The bigger problem is when you wake up and you can't go back to sleep, although you haven't slept enough. Let's say you've already slept for 8 hours, and then you wake up, you cannot go back to sleep. Well, that's normal because your brain is rested. But let's say you only slept for 1 to 2 cycles. You have only been sleeping for 1.5 hours to 3 hours or 4 hours. But when you wake up, you can't go back to sleep. That is a bit more problematic. And it is generally associated with two things. Number one, depression. You are feeling depressed. So I'm not saying that you have clinical depression, that you want to kill yourself. I mean, although some people, if they have clinical depression, they're most definitely going to have early waking syndrome. Even if you don't have clinical depression, you are just feeling depressed on that particular day. You'll notice that when you wake up in the middle of the night, it's difficult for you to go back to sleep. The second thing is aging. when you get older, this problem tends to happen more often. But then, and that is why a lot of elderly, once they wake up in the middle of the night, they say, I wake up, I don't need to go back to sleep. I feel okay. I will just start working. I will just start preparing meals for my family. I will start doing gardening. And they just stop sleeping. That's not recommended. So if you are an elderly and you have less sleep, even if you can't go back to sleep immediately, get out of the bed, do something, but later in the day, you should still find some time to take a nap to allow yourself to have about 6 hours to 8 hours of sleep, if possible, right? So I will go on to the next slide first. Then, if we have time, then I'll talk a bit about what are the strategies we can use to improve the time, meaning to reduce the time you spend in bed so that you can fall asleep quickly. I will talk about that later, but let me just go through the slides. Okay. Sleep hygiene. So sleep hygiene is something that Jess would share, right?
Yeah.
Okay. So Jess, you can
Yeah,
share this first,
can.
and later I will screen through the questions and I will highlight some to address later in our Q&A sessions.
Oh, perfect. I think we're getting quite a bit of questions from that part, so keep them coming. All right, so we're going to go to just some sleep hygiene um, tips and tricks that you can try as well. And I'm sure Shawn is going to add to that a little bit later. So I think there's a part that he also shared about the temperature of the room. So ensuring that you keep your space or your bedroom in a cool temperature. Some of us, we're not used to sleeping with AC throughout the night. So what you can do is turn it on, cool the room down, and just before going to bed, you can switch it off. Or you can even put a timer on, so that way you're not having the AC throughout the night as well, right? I know we've been experiencing a lot of heat lately. I think we're in a heat wave at this point of time, so I'm sure all of us have our ACs on. Reduce noise. So as Shawn also mentioned, some of us are a bit more sensitive to noise, so you can try the white noise machines as well, or even earplugs. This is quite helpful for me, particularly because I'm quite a sensitive sleeper myself. So it depends on the location or where I'm at. Sometimes earplugs can also help to not completely block out all the noises or sound, but they do help to a certain extent. One of the common ones that I use is Loop. I don't know if you guys are aware of this brand, LLOOP. So you can actually find different fixtures to this earplug depending on how much of soundproofing you would like. So, for example, I think they follow decibels if I'm not mistaken. So, certain noises, it might be too loud. You might be, staying close to a construction, a place or something like that. So, you want to have more soundproofing. So, you have something that you can actually insert into the earplug so that it completely blocks out the noise. For some of us, we kind of want to hear our child or our baby, so maybe reducing the parts for the earplugs as well would be helpful. The third one is decluttering and having a calm space as well. So a lot of times when we live in a home or space that has a lot of clutter, what that does is also brings clutter to the mind. So it does not promote, a space where you feel peace and relaxation. So ensuring that your at least your bedroom is a space where it's free from clutter, it's free from messiness, and that kind of helps promote relaxation as well, and just a sense of clarity, I would say. Minimize light. So some of us are quite sensitive to light as well. I think blackout curtains are one of the biggest investments you can possibly have. For those of you who don't use blackout curtains, you can also try eye mask as well. And comfortable bedding, so ensuring that the type of linen that you're sleeping on is comfortable. Some of us are quite sensitive to different fabric or different texture, so you might want to also see what works for you as well. And reserve the bedroom or the space where you sleep just for sleep, right? A lot of times, sometimes we eat or we watch TV and movies, so it's very much associated with like a space where, you know, everything is there, right? So essentially what we want to do is really set up a space, set up an environment, set up a little corner where you associate that space only for sleep, right? um, yeah, I think that's my part. Sean, you have anything you want to add on from this part? I think we're going to add on the handouts as well. So Divya will be able to kind of share that with you. I think for those of you who are using your phones or laptops, you'll see a pop-up, which is a sleep hygiene handout that you guys can download or save as well.
So I just scrolled through some of the questions and I've highlighted a few to address here. So I'll talk about caffeine. Um, Apparently, if you are a long-term user of caffeine, it shouldn't have too much impact on you. But then, of course, the data we have is based on the overall sample that we have collected. The impact of caffeine can still be individual. So, in short, you need to do your own experiment to play around with caffeine, to drink a bit to see whether it affects you. For me, for example, right, caffeine doesn't affect me in any way. I can drink, even espresso at night and I will be able to sleep. However, if I suddenly change to tea, for example, I drink teh or ice kosong at night, suddenly I'm not able to sleep. Technically speaking, teh or ice limao's caffeine is less than espresso, but I can sleep with espresso, not teh or ice, teh or teh si kosong ice, teh si kosong ice, right? So our brain would adapt to these kind of chemicals when we consume it in the long run. So far, most studies have shown that if you use certain substance in the longer run, meaning caffeine, in the longer run, it doesn't actually affect your sleep. You will still go back to your natural sleep cycle. Now, is sleep gummy or melatonin or some other supplements helpful? In short, you shouldn't need them. If you but there's also not a lot of harm using them. A lot of the studies that came out from our university showed that it does help a bit, but my stance is still, if you can go to sleep without them, you should try that first, right? Because why spend money on something that you don't have to if you can do it on your own? So another thing I want to address here, because some people have also mentioned about exercising, they are very tired, but they still can't fall asleep. That's because there is a difference between feeling tired versus feeling sleepy. Tired is a term that we usually describe body fatigue. If you go for a marathon, after that your body will be tired, but it doesn't mean that your brain is sleepy. You can feel sleepy by sitting all day doing nothing, but when time's up, you will still feel sleepy. What we know to help with sleep is the feeling of sleepiness, and that has a lot to do with how you use your brain. The problem is some people, even if they overuse their brain, even if they are really fatigued, very sleepy, they still can't fall asleep. And that's mainly because they are still very active in their brain. They are preventing themselves from falling asleep. And there's a question about white noise. Generally speaking, white noise should be fine, right? A lot of people, in fact, in nature, most of the time people sleep with some background white noise. Olden days when we were living, in kampong, we have cicada, the insect, right? We have a lot of background noises. We have wolves. All these things didn't actually affect our sleep. So right now, if you need white noise to help yourself sleep better, to cover all these, unnecessary interruption, that's fine. As long as your partner is okay with it, right? And that's if you are sleeping with a partner, right? If your partner is not okay with your white noise, then you don't have a sleep problem. You have a relationship problem with your husband, with your partner. So another thing is about nightmare, right? So this has something to do with dreams and the content of your dream. I often get the question of whether dream would affect quality of sleep, because I'm dreaming too much at night. It means that my brain is not resting because I'm thinking too much. Now, on the contrary, the fact that you're dreaming, it means that you're asleep. You need to be asleep to dream, right? So you should think about this as, if I can dream, it means that I've slept enough. It's just that some of the dream content, I'm not very happy about it. The important thing to do about your dream is to let it go, right? Because we know that dreams, although they can evoke real emotions, if you dream of someone you love that has passed away, you may actually cry when you wake up, right? If you dream of yourself getting promotion or winning lottery, you are still not a millionaire. So they would give you real emotions, but then they should have very little impact on your real life. So once you wake up from the dream, you should actually just let it go. Another tip I want to give here is that if you are in a dream, when you realize that you are in a dream, there is a very good chance that you are waking up. So someone asked the question about lucid dream, right? Lucid dream is a very interesting question. We are still doing a lot of research, but generally speaking, because I personally have not experienced lucid dream, every time when I am aware that I'm dreaming, I'm almost waking up. But people who say that they have lucid dream can still stay asleep even while they are being aware of the dream state. So it is something that I can't give you a direct answer to as of now. In maybe 5 to 10 years time, when we have more research data on lucid dream, you can probably come back to me for more updates on this. Okay, so sleeping in chunk, afternoon nap, they are all okay, right? So in the past, we encourage people to sleep a whole stretch of 8 hours in the night and not sleep in the day. Actually, that's generally speaking not how our body works. We have some evidence to show that sleeping during the day can actually help with our work performance. The problem now is that the society is built around having a very active daytime activity, and at night you are supposed to sleep. So the problem with not with taking nap in the day is more social than biological. Because imagine if you sleep 4 hours or 2 hours during the day, that 2 hours is probably the time that your colleagues are working, your business partner is going to have a meeting with you, your family members expect you to have lunch with them. So if during this time, other people are doing work, but you are sleeping, you are missing out opportunity with them. So now we are all forced to sleep for 8 hours in one stretch so that we can still socialize with other people. If in the future, the world has recognized it's important for us to sleep in between, maybe 2 hours of nap during the day will become a norm. I mean, I don't know. But right now, if your schedule allows for nap time, feel free to do so, as long as you are still getting about 6 to 8 hours of sleep. Now, my last message that is going to help, I'm hearing a lot of people asking me to give some tips on how to sleep, right? So this actually requires a whole consultation session for me to teach, but I'll give you some tips on how you can do that. Can someone answer me, how do you generally know that you have fallen asleep? How would you know that you have fallen asleep? Okay. So interestingly, if you think about this, if you notice that your body is jerking, you're not asleep because you're still aware, right? If you realize that you're dreaming, there's a good chance that you're waking up. Yes, Putri has got it right? And also Jason, loss of consciousness. When you wake up the next morning, you will never be able to catch yourself fall asleep. You can only know that you have fallen asleep once you wake up from it, which means that the process of falling asleep is not something that we can be mindful of. You really just have to let your mind and brain go blank. When you notice that you are starting to generate thoughts, you're starting to be aware of things, you have to let that go, right? And just stay blur. If you are having a brain fog, right, don't try to fight that brain fog. Just try to experience that brain fog. Notice that your brain is not able to think, and just focus on the ability, just relax and just observe that your brain is not able to think. Eventually you will fall asleep, right? So when you're aware of your own snoring, again, when you're aware of something, you are not sleeping again, because the definition of sleep is the loss of consciousness. So right now, if the thing that you're trying to do to help yourself fall asleep is very control oriented, I have to breathe slower to make myself sleep, I have to count sheep, I have to do a lot of things to make myself fall asleep, it won't work. Because sleep is something you allow yourself to experience, it's something you allow the brain to get into. So you have to shift your thinking from making myself fall asleep to allowing myself to sleep. So there are a lot of techniques that can help you stop your thoughts, reduce your thinking, but we don't have the time to talk about this. Later, when we share, the resources that Naluri has for consultation, you can probably reach out to someone to ask about how you can improve sleep. But overall, right, you want to learn to let go and allow sleep to happen, and not try to do too much to force yourself to fall asleep. I hope that makes sense. Okay, so Jess.
Yeah, thank you. All right, I think we're kind of nearing the end of our session today. So I'm just going to share with all of you the support and resources. And if we have a bit more time, I think we'll take on a few more questions as well. So for those of you interested to, have the free 24-hour care line session with our mental health professionals. You're more than welcome to take down these numbers if you want. You can, take a picture. These are our text line numbers. So we do have it all across Southeast Asia. So depending on which country you're from, you will be able to reach out to our mental health coaches. Remember, it's 24/7. So at any time you do need support, or you're struggling, focusing or struggling with sleep, you're more than welcome to reach out to our coaches as well. We also have the one-on-one consultation services as well. So feel free to scan the QR code to book a session with our coaches. So you'll be able to come to the landing page and have a look at all of the coaches that we have available. You'll even be able to click onto their profile and read a bit about their specialization. So depending on what are some of the issues or concerns that you want to work on, you'll be able to find a coach specific in that area, right? We also have the free emotional well-being assessments, which you'll be able to assess on the Naluri app as well. It's free, and you will remain anonymous, of course, and you're more than welcome to also discuss your findings with the digital coaches as well. Yeah. We also have Naluri on web version now as well. So if you're interested to check us out on the website, you can scan the QR code, or you can also download the app as well. All right, and stay connected with us if you are interested to find out more about our next topics and next webinars as well at naluri.live on Facebook and Instagram as well. We're just going to share the feedback form that's going to be popping up on your screen. So feel free to just take a little bit of time to give us your feedback, share how the session was helpful for you, and also give us some feedback on what you want to hear, in the next 6 months of this year as well. Any topics that you would like to hear from the coaches and the professionals as well. All right. Okay, I think we still have a bit of time. Not sure if we want to take any more questions, Shawn, or
Yeah. So I saw two questions that are quite interesting. So one mentioned about having a child with autism. Is there a way to help the
yeah,
child sleep better? The answer is yes, but it's not something that I can share that easily. Overall, individuals with ASD have indeed a pretty unusual sensory profile. So the way they experience light and sound can be a bit different. And if we can, understand the situation a bit more, we can work with the occupational therapist and a psychologist to work on how to help the child sleep better. But of course, in that case, the parent will also have to learn the way to soothe the child and to bring the child to sleep. Also, another question is how old is the child? Because the child's age matters when it comes to the strategy that we recommend. The other question is regarding nocturnal nature of Sanso's shop. Now wanted us to respond to this. I'll read out the question. My son is nocturnal. He's able to focus and study better during the night until early hours of the morning. Then he sleeps during the day about 6 to 7 hours. But when he awakes, he's usually not very active. Is this bad for his health? So then another question here is, again, how old is he? Right? Like I mentioned, right now we know that the duration of sleep is extremely important. But the timing of your sleep, right, is more about social rather than health. In the Chinese medicine concept, they believe that you should be sleeping at the time of 11 p.m. till the next day. So 11 p.m. to 1 a.m. This time, Chinese medicine people believe that you definitely have to sleep. If not, something will be wrong with your blood, with your liver or kidney or something. In Western medicine, there's not really such a concept, but I don't want to, deny other people's body of knowledge without actually understanding. From a Western scientific perspective, it's more about the social implication of that. If your son is sleeping at a time where everyone is having fun, he may be able to excel in his academic work, but will he have enough, friends that he can share his joy with? So when we think about sleep, we have to think about this as 1/3 of our life. So it's not just about health, it's not just about what time we sleep, it's also about how we relate to other people. I hope that makes sense. He is 20. Yeah, I also suspected something around that because when I was his age, I also did something like that. I was also, a nocturnal thing. But actually, this nocturnal concept is quite interesting. Was he always like that since young, right? Or did he learn this behavior when he entered uni? So That's the idea lah. Is there any question that we should be addressing? If we take nap after lunch to increase energy, is that okay? Generally speaking, yes.
Mhm. I think we had a question earlier about sleepwalking. A few questions around.
Okay.
I think it was sleepwalking. Yeah.
Yeah, I can address that a bit as well. Sleepwalking is a very interesting topic. It
Mhm.
generally happens when you are in your REM sleep. So before we get into our REM sleep, just now I mentioned that REM sleep is a state where your brain is extremely active. It is as though you are having a seizure. Before that happens, your brain will generally send a signal to inhibit your body, right? So your body will not be able to move during that period, because imagine if your brain can allow your body to move during that period. A lot of people may start to have seizure behavior, and then you may knock yourself, you may fall off the ground. So the brain and the body has a very interesting mechanism to protect you from that. But then for some people, especially those with sleepwalking, their brain is not inhibiting their body's movement. So when their brain is being extremely active, their body is allowed to move. But you will also notice that people who are sleepwalking, generally speaking, they do stuff that are quite smart. If they go down the stairs, they don't trip. Like even when you are awake, you trip. But for people who are sleepwalking, they can go to the bathroom, they can go to the kitchen, and they are still fine. So this is really a phenomenon that is telling us that sleep is a very complicated experience. When you are losing consciousness, when you don't know what's happening, the brain and the body and all your sensory organs are actually still doing something to keep yourself safe and to keep processing certain information. But it's a condition that this sleepwalking is a condition that is associated with sometimes stress or whatever. And once you have sleepwalking, having stress, having other emotional disturbances will actually aggravate the frequency of you having sleepwalking. If you don't have it, you generally don't have it. Okay, so what other
Mhm.
questions do we have? Uh, if for a 2-year-old baby is napping during daytime encouraged, I found him difficult to fall asleep. So for very young kids, the advice is just to allow them to sleep whenever they want to. You don't have to really force yourself to train them to follow a certain sleep schedule. They will just wake up when they need to wake up. They will just sleep when they need to sleep. Okay, is there any interesting
All
question?
right.
Yeah.
I think we had some questions about the recording. So we will be posting it on the YouTube page as well as the Naluri website. And you also get the attachment of the presentation today as well. I think you're able to download it. I think Divya, you've shared it already, right? Yes, she has. Yeah. So you're able to view the presentation just in case you miss it out.
Okay.
Okay, I think that's all the time that we have for today. Thank you so much, everyone, for joining our session today. And we hope you have a good day ahead as well. We hope the session was impactful for you. All right, take care, everyone. Bye bye.